Hmong?
Let's find out what that means. Contact social services, see if we can get somebody down here and talk to them.
Do I continue to process her discharge?
Yeah, we have to. It's insane, but we have to. It reminds me of this case I had in New York one time when this woman came to the office and...
Look, do you need me for anything else, work-related?
Mr. Chu! You want to take Anna home for a healing ritual?
When sickness comes, it means one of our souls is missing. Anna needs to have her souls intact before she has surgery. She needs a shaman.
You could have told me that.
Why? So you can call me a fool?
I respect that you have traditions that I can't understand. But you're standing beside me in a $3,000 suit, so I also know that you respect the fact that I'm telling you Anna needs a surgery in the next 24 hours if she's going to continue to walk. She can't leave this hospital.
She can't undergo surgery without her soul. She'd die.
All right, then. We're just going to have to get a shaman. Today. In the hospital.
Shamans aren't listed in the yellow pages. Our shaman is 500 miles from here. You are an arrogant man.
No. I'm just a guy with access to a helicopter. Thank you.
Finding her soul won't be easy.
Never is.
Okay, Anna, we're gonna shut off the PCA pump now, which means you'll be in a lot of pain for the duration of the
healing ritual.
Are you okay with that?
Yeah. I can't find my soul if I'm medicated. No pain, no gain, right?
Well, it's not just for your father. You believe it too, right?
I know it sounds like a load of crap, but watch the ritual, you'll see.
See what?
The moment it happens. I'm ready.
Of course she got her soul back. It's Grey's Anatomy. We're amazing surgeons. I feel so underprepared after hearing the SVU guys. Like they're all like prepared, and I've been jotting down notes so I could seem just as prepared. But I feel like this particular story was so much more of a cultural relevance type of situation than it was like a socially relevant. I mean, we try to do both on our show. We don't have the privilege and honor of having a showrunner who is so very into the cultural relevance and the social relevance and trying to get issues out there, which I think is such a blessing to have Neil Baer there, that someone who really, really on a top level can fight for those things and understand those things and understand the complexity and really fight the networks and just fight to get the information into the story. Because I find that I have the same problem as Dawn. Yes. Because when you research this stuff, every show that we do, every story that we do, especially if we're getting consultants, we usually get our consultants a lot from Hollywood Health and Society. When we have a question about something that I can't answer, which is rare, but I'm emergency medicine trained, so I know a little about a lot. So usually to delve into the stories, I'm going to need some kind of consultant, some kind of expert that knows more in depth of the facts of what we're doing. And every consultant that we go to or go out to, we always ask them, what is the public health message that you would like out there? We take those things down. We try to get into the episode, but very oftentimes those things will fall out just because of the fact of what, I'm sorry, I forgot your name. John was saying, is that it's all about entertainment. You know, it's especially for Grey's Anatomy, where the top level people aren't as concerned about getting little tiny messages out there. We're concerned about what message we're putting out there at all times in the writer's room. We're like, you know, well, if we tell this story, what message are we sending to the general public, to the millions of people who are watching our show? For instance, we haven't been able to crack like an anorexia or bulimia story because we feel like even if we portray it as being this horrible thing, if we give a website or if we tell some information, somebody's going to use that in a negative way. So we haven't been able to crack it in a way that is satisfactory to us, that we will be giving a message that's good enough to get out there. So you get all this information and you try to put it in there, and it's a matter of trying to not sound too preachy, trying to meld it into the entertainment value. Like, for instance, what I thought was interesting, one point that I hadn't really seen before in this episode was when they came in with the shaman. Over that, we're playing like this indie pop song that's very relevant to Americans, to like young people today. That song is very popular now, but it wasn't then. But it still has that kind of, you know, upbeat. You can get with it, and it brings you into the story in a way that I think if we had played like solemn music or, you know, even cultural music, it wouldn't have brought other people into their culture as well. And that's what we also try to do with our casting, is to try to, first of all, not perpetuate any stereotypes. One of the good things about my showrunner is that she's a black woman. So she is very interested in not, you know, if there's any drug dealers, or, which we don't have that often, but if there was something like that, they wouldn't be black. They just wouldn't. There would be no way they would be. We try to go against the stereotype in most instances, unless it's like Hmong. You can't really, you know, not cast an Asian person for that. So we're very aware of that kind of thing with our casting and with our storytelling. We had one episode of an HIV where we actually did tell the same kind of story, not as intense. We did not have a videographic because our show doesn't lend itself to that sort of thing. One of the problems with getting information in with our story is that we're telling stories about surgeons. So in some way, we have to have some kind of surgical dilemma or some kind of way for our surgeons to be involved in it in, you know, a way that makes at least a modicum of sense. Sometimes it's kind of hard to get exactly what we want in there based on that, but we were able to do an HIV story where we did put the facts in about your kids being 98%, you know, not getting the HIV virus if you took care of yourself during pregnancy and took the medicines. We had a clinic that we had opened for a while, so we were able to take care of some more kind of general social problems that weren't as surgically relevant. So we had some nice little things that kind of dropped out now because Izzy's not around as much and she opened the clinic. But one episode that is coming on tonight that was written by me.
What time?
9 o'clock on ABC. We actually were able to delve into quite a few issues because it was my episode, and I was able to do push a little bit more, and had more control over exactly what ended up in the script. A little bit more. There's still a lot of, you know, once I write it, it goes to our executive producer, and then it goes to Shonda, and it's a big process of trying to keep in as much as you can. And then once it's shot, even if you've gotten a lot of things in, if you're 10 minutes over, it goes to editing, chop, 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 chop. So the final cut is not always all this information that you've gathered and all this information that you wanted out there, and you just try to get it out there in some other way or hope that the general message has been portrayed. So tonight, we're flashing back. I can tell you now because it's coming on. We're flashing back to like 1982, and one of the stories is about Richard, who is our chief of surgery, who was a resident in 1982. And Shonda has always emphasized that Richard and Ellis were the only black and the only woman resident in their surgical residency during their time. So that kind of drew them together at that time. And then when I was thinking about what story could we tell about that time, HIV was that was when it was just being discovered and nobody knew what it was. And so it was the whole concept of being like outcasts, you know, being that whole thing. So it was really, really great because we were able to like bring in an HIV patient who had been trying to hide his gay status, and now he was out there and he couldn't hide it anymore. And the three of them kind of bonding and understanding each other, and you know, bringing the whole it's basically a lecture series. So we were able to do more of what they're able to do every week when they're in the the courtroom. I'm a doctor. When they were in the courtroom, they get to do these lovely speeches where they can say all this relevant information and just get out facts and show videos and do all that wonderful stuff that we are not able to really incorporate in any kind of way that makes sense on our show. Because it's also about sex. I don't know if you know that. So it's really about the relationships of our characters and how these patients come into the relationship of our characters, and how they inform the relationship of our characters. So all the information that we get out is usually informing on our characters in some way. So tonight that's why that was so relevant. You know, it actually worked, and we were able to get a lot of that just initial HIV prejudice out there, and it's just, I think it's a really kind of amazing way to like tell that story. And I also got to do a polio story, which is one of the few like global health issues we've been able to tackle on our show. And it's basically it's like with Dawn. It's like I had all this information about polio, and I really wanted to just spit it all out there, especially since it was a lecture series. So it was, at one point, we have Callie, our orthopedic surgeon, where she has terrible, terrible stage fright. Like, she is just a horrible public speaker. So I had her just, like, railing off information, just, like, reading off from a note card, just everything I could possibly spill out about polio. That's all been cut down to about this much. But it was so interesting, like, all the information that I found. But the fact that it's completely eradicated except for in like 4 countries in the world. And the fact that in Nigeria it was almost completely eradicated at one point, but there was a conspiracy theory that started about 2003 where I guess the president was saying that Americans were trying to put anti-fertility drugs into the vaccines and trying to sterilize their children and maybe lacing them with AIDS and that sort of thing. So the rates just skyrocketed from there, and you know, I couldn't fit that in my episode. The actual vaccine thing is kind of hard for us to put in our episode because we do have one high-level member who has children who are not vaccinated. But she's coming around, and I actually, that's off the record, by the way, I actually was able to get the word, eradicated by vaccines. I was so excited, and it got cut in the final. Maybe it'll be in the director's cut. But basically, stuff like that, when you have higher-level people that are not as involved in just those tiny messages, it makes it a little bit harder to get them out there. But again, we are very concerned and very interested in the messages that we put out. So although we don't get all the little facts, we get hopefully a lot of the big picture stuff out there. And we really try to tell a story that is going to be maybe not socially relevant, but socially responsible, Let's see, is there anything else? Well, I wanted to talk a little bit about Hollywood Health and Society. I mean, we find them to be like a great resource. As I said, I know a little about a lot, so there's always, we can always just call them up. For the polio thing, I wanted to just talk to someone about, what are the relevant issues that we wanted to get out there. For the HIV story that we told, there's always something that they can come up. Actually, we will read like the craziest cases. Like, we don't rip from the headlines necessarily, but we rip from the medical headlines. Like if there's some crazy case that's been done, especially if it's some crazy surgery, we'll bring it in. And half the time, the medical reporters, I have no idea what they're talking about because I think because there's, they're not doctors and they're doing like a generalization, and I'm like, how did you get from A to B? I do not understand. And we'll call Hollywood Health and Society, and they would literally get us the specialist that did it. My last episode was on a face transplant,